Hi friends, how many of you are affected by snoring, either directly or indirectly? Directly, either you snore, or indirectly, the person next to you in the bed snores. So there is a general misconception that persons who snore have a very deep and happy sleep, and only the people who are next to them are affected. But this is completely false. If you notice persons who snore, even after getting up in the morning, when they lie down, immediately they go to sleep and immediately they start snoring. So what is the cause of snoring? Obstructive sleep apnea is a severe form of snoring. If you see a normal airway allows the free flow of oxygen and there is normal breathing. The breathing is not affected. But in snoring, there is a small tongue-like structure called the uvula. In this region, there is a small restriction of the airway, and during sleep, this restriction causes this uvula to vibrate. So this vibration produces the snoring sound. In obstructive sleep apnea, this airway is completely blocked and the breathing of the patient is also completely blocked. So after 10 to 15 seconds of heavy snoring, the patient's breathing may stop, the patient will get awakened and they will slightly awaken and they will again start to breathe and again go back to deep sleep, snore, and again they will wake up. So this cycle is repeated throughout. So in snoring and obstructive sleep apnea, the persons do not have a very deep sleep, and that is why they are very tired during the morning after getting up, and they are very prone to road traffic accidents. So what is the reason for this obstruction? Mainly increase in weight and increase in fat accumulation around the neck area. Another cause is late night alcohol consumption, because alcohol causes this small uvula to lose its rigidity and become very flabby. This flabbiness causes more vibrations during snoring and severe sound. And other causes may be nasal blockages, nasal septal deviation, adenoids, etc. So what are the treatment for this snoring? So the first treatment is behavior management. That is, you have to have some reduction in your weight. Next is reduction in alcohol consumption, especially during late night. Another thing is, instead of lying straight in a supine position, the person can lie sidewards during sleep. So how can you maintain the sidewards position during sleep? You can actually roll a pair of socks or something and keep it in the back region so that the patient does not roll back to the original position. Now there are also some dental devices for correction of snoring. So these dental devices are marketed in some manufacturers as silencer. So what these dental devices do is, this dental devices during sleep, it brings the lower jaw forward. So once the lower jaw is brought forward, this reduces the obstruction of the airway and it reduces the snoring, and this is mainly successful in mild to moderate cases of snoring. It can also be tried in severe cases of snoring. So the gold standard treatment for snoring is a CPAP machine or a BiPAP machine. So what is a CPAP machine? It is nothing but a motor which supplies oxygen through a mask. The patient is made to sleep with a motor inside of him with a mask, and this mask will continuously supply oxygen during sleep and the person will have a very deep sleep. But the disadvantage is that the person lying next to him will hear the sound of the motor during the sleep. The most definitive treatment for snoring is surgery. So there are many surgeries which include reduction in the size of the small tongue or the uvula, but the disadvantage of the surgery is that it may cause a change in the voice of the person. So these are the treatment options for snoring. I hope this video was useful to you. If you have any questions, you can post it in the comment section below. You can also send me your questions in the WhatsApp number 90952 80903. If you like this video, please do subscribe to the YouTube channel. Thank you.